Hello, my name is Marie-Sophie Robert, so I'm project manager of SPECTA.
Hi, I'm Marie Marfouès. I'm the translational research scientist in SPECTA.
SPECTA is the EORTC infrastructure that facilitates the cancer patient recruitment. It enables a rapid access to the patient clinical data and samples. How do we do that? We can do that thanks to our EORTC network of centers, as well as a generic protocol for SPECTA. And finally, we are using the patient-informed consent. So this patient-informed consent is signed only once by the patient, and then the patient can be recruited in all SPECTA downstream projects. SPECTA is a pan-European platform. Once you're authorized to recruit within SPECTA, you can recruit patients for all SPECTA downstream projects. Currently, 3 projects are recruiting. So we have more than 200 investigators who are in the process of joining SPECTA from more than 20 countries.
So we have 2 main goals. The first one is a broader goal, which is it's to better understand the biology of cancer in order to develop rationale for the next generation of clinical trials and to build knowledge on cancer, especially needed for rare cancer. But we also have a more patient-centric goal, which is to help with diagnosis confirmation by expert pathologists, but also to guide patient treatment by giving clinician a molecular profile of their patient. So the patient is enrolled in SPECTA, the clinical data get into the EORTC clinical database, and then the samples is analyzed to provide a molecular analysis report in usually 6 to 8 weeks. In the same time, for a certain project, we can also organize a diagnosis confirmation by pathology experts. Then the molecular biologist, the clinician, and the pathologist get together in a virtual molecular tumor board to try to come up with ideas of treatment adapted to the patient and recommendation for future treatment. First, it's a great patient-centric study. You have a free molecular report in around 6 to 8 weeks after patient eligibility. Then you will also have access to all the profiling data for your patient. Second, it's also a really great scientific outcome with authorship possibilities on publication. You will participate in the generation of a big molecular and environmental database to try to understand better the biology of cancer. And then you can also go do future research and samples and data that will be generated in SPECTA. Finally, you also have financial compensation. You have a compensation at the site level when you open SPECTA, but you also have a compensation for every patient eligible in SPECTA. And obviously, all the costs for the HBM shipment and analysis will be covered by SPECTA.
So once you express your interest, we'll be able to contact you to confirm your interest. Then we can start the regulatory submission process together with the initiation package. Once all EC approvals are received, then the final authorization is given by EORTC.
How can you participate? To join us to enroll patients in SPECTA or to propose new projects in SPECTA, just contact us or go to the SPECTA website.